It's a test that everyone dreads, a colonoscopy, where a tube is inserted into the rectum and up into the large intestine in search for signs of cancer. According to Dr. Ike Aquinili at the University of Miami, a colonoscopy is 90% effective in detecting polyps that might later become deadly. He says early detection is key to preventing colon cancer.
So you actually expect that a lot of people would be excited to get screened for colon cancer. However, you have to think of it this way. It's invasive. You have to put something through somebody's behind, and a lot of people don't like it.
The fear associated with a colonoscopy prevents many people from getting screened, and as a consequence, colon cancer is one of the deadliest of all diseases. But Dr. David Ahlquist of the Mayo Clinic says there's now a new option for colon cancer screening. It's called Cologuard, and it identifies genetic markers for cancer in stool samples with 94% accuracy.
I think that availability of this test, because of its high accuracy, it becomes a legitimate frontline test that patients and physicians or providers have the choice now to use this as opposed to colonoscopy as a frontline test.
Unlike a colonoscopy, the test begins in the privacy of a patient's bathroom, where a stool sample is collected. The sample is then sent to a lab in the mail. At the lab, an automated system analyzes the stool for 3 genetic markers that indicate if any polyps or early-stage tumors are present in the gastrointestinal tract. Dr. Aquinili says the screening tool provides a new option for people who are scared of a colonoscopy.
Because patients do not have to go through a procedure that is considered invasive, it might increase uptake and make more people who are hesitant about getting screened get screened.
And if more people are screened, Dr. David Ahlquist says fewer people will die from the disease. He says Cologuard could have the same impact on colon cancer as the Pap smear had on cervical cancer.
Cervical cancer used to be the most common cancer killer in women. When the Pap smear was introduced, it became a rare cancer in those women who were screened. There's no reason why application of Cologuard broadly through our population couldn't achieve the same thing for colon cancer. Our goal is to eradicate colon cancer.
Dr. Ahlquist says the researchers are now expanding the test to include other forms of gastrointestinal cancer. Their ultimate goal, he says, is to fine-tune genetic testing to the point where doctors can effectively identify and prevent cancer before it has a chance to develop.